We can have the discussion at the end of the session. Next speaker is Dr. Mini PA. She will be talking on calibration of Applanation tonometer. It is very important to calibrate the tonometer before using it. Over to Mini.
Good afternoon. An accurate measurement of intraocular pressure is important in the management of glaucoma. So, even though various tonometers are available for measurement of intraocular pressure, Goldman Applanation tonometer is the gold standard and is the most widely used one. To get an accurate measurement with this tonometer, it is important to check the calibration error of the instrument periodically. So let us see how to check the calibration error of Goldman Applanation tonometer. Let us see how to check the calibration error for Goldman Applanation tonometer. First of all, mount the Applanation tonometer on the slit lamp. The calibration error checking should be done at dial positions 0, 2 and 6. To check the calibration error at position 0, we have to rotate the knob to position 0. Now turn the knob a little forwards, that is about 0.5 millimeters of mercury forwards, and we can see a forward movement of the feeler arm with the tonometer head. And now if we turn the knob backwards a little, that is about 0.5 millimeters of mercury, we can see a backward movement of the feeler arm and the tonometer head. To check the calibration error at position 2 and 6, we need a calibration error check weight bar, which is provided by the manufacturer along with the tonometer. This weight bar has 5 markings on it. The central marking corresponds to 0 millimeters of mercury, 2 markings on either side corresponding to 20 millimeters of mercury, and 2 outermost markings correspond to 60 millimeters of mercury. There is a adjustable weight holder to insert this weight bar. So we can insert the weight bar into the weight holder and insert the weight holder onto the slot provided on the side of the tonometer. Now adjust the weight bar in such a way that the marking corresponding to 20 millimeters of mercury should come in line with the index marking on the adjustable holder. Turn the knob to position 2 and now rotate the knob a little forwards, about 0.5 millimeters of mercury, and we can see a forward movement of the feeler arm and the tonometer head. And now rotate the knob a little backwards and we can see a backward movement of the feeler arm with the tonometer head. And to check calibration error at position 6, we have to adjust the weight bar in such a way that the marking corresponding to 60 millimeters of mercury should come in line with the index marking on the weight holder, and turn the knob to position 6. Just rotate the knob a little forwards and we can see the forward movement of the feeler arm with the tonometer head, and now when we rotate the knob a little backwards, we will see a backward movement of the feeler arm with the tonometer head. So ideally at all these 3 positions, this movement should occur within the range of 0.5 millimeters of mercury. So if we do not see this movement, then we have to send back the tonometer for recalibration. Thank you. Thank you.
It was by Dr. Mini. Yeah. So thank you. That was really nice, Dr. Mini. Yeah, very nice actually. And I think day to day you may not be doing this, but at least once in a week or once in 2 weeks, or if you suspect that there is an error, definitely you should do. And the easiest is that the first step that she said, keep it at 0 move it a little 0.5 anteriorly, see that it moves anteriorly. Then you get it back to 0, move it posteriorly, an anti-clockwise rotation. You'll see a backward movement. This should be equal. Then it is calibrated, it is good. Then you can proceed. And please, if you have multiple tonometers in your hospital, try in the same patient in multiple patients and see whether there is an error and that this needs to be calibrated. Otherwise, you should do a periodic calibration. Thank you. That was a nice one, actually. Basic, very important one.